Okay, as you guys know, I'm in school for my bachelor's degree, and we have a capstone project we had to do for my last semester. And we had to find a policy or something we believed needed to be changed where we work. And I took a different twist on this than everybody else. And I looked at our fall risk assessment tool because we did just get a G tag from our state survey. So she thought that would be a good thing to look at. And we do have a lot of behaviors too, so I took that into consideration and I found a behavioral fall risk assessment tool that may work more for our behavioral people than just like our skilled or medical people that we have. So as we all know, falls are very frequent in our older people, especially ages 65 and older, and they are a critical health problem for this age group. And combined with all the other health problems they have, fall and everything, it just increases their risk even more for that fall. Some of the risk factors that they have, one that I found was very interesting is a decreased vision due to the amount that is able to get through to the eye. I found that interesting, but the 12 common are age, history of falls, muscle weakness, mobility assistance, loss of balance, altered mental status, restlessness, deterioration in judgment, understanding, a loss of memory, frequent urination, if they need assistance with toileting, and use of restraints. I know we don't do that often, but that was one. And I also had to find 5 studies that went along and provided scholarly information for this topic. For my first research study, it was risk factors for mentally ill geriatric patients. There was 20 patients that started off in the study, but if they were under 60, they were eliminated. So in the end, there were 12 that were left. Intrinsic and extrinsic factors were examined, and 58% of the people in the survey were female and 42% were male. 75 of the patients were 60 to 69 and 17% were between 70 and 79. 8% were over the age of 80. 57% of women participated and they had a diagnosis of schizophrenia, and 29 had paranoid schizophrenia. The male numbers weren't listed in that. 67% of the falls occurred in the bathroom, while 20 happened in the bedroom, and then 8 in like a courtyard type area. So the findings for this study were that being female, having schizophrenia, and being on a psych medication were the predisposing factors for risk, and that made those people at risk for the falls. Research study 2 was the characteristics of psychiatric patients who fell. So this was anybody that fell that had a psych diagnosis. This was a medical center in Virginia, and these records were in Q3 in 2011. And then they compared the results to Q3 in 2012. The people that put on this study found the Edmonton Psychiatric Fall Risk Assessment Tool, which they used for their quarter in 2012. They had used their standard current fall risk assessment tool in 2011. And the 9 categories that this addressed was ambulatory status, medication, psychiatric illnesses, sleeplessness, undernutrition and fluid intake, anxiety level, depression or psychosis, and mental status affecting judgment. During this study, it was found that the patients that had the most falls were 40 to 60. Gender didn't have a role in this, and of the 16 falls, 11 of them happened within the first 3 days of hospitalization. the top 3 medication categories that these residents were on were antipsychotics, benzodiazepines, and antidepressants. As we know, a lot of our residents on back hall, and there's some on front hall that are on some of those. And the actual top 2 prescribed medications were trazodone and lorazepam. And with using the psychiatric fall tool, they had under 5 falls for their second quarter, and they had 16 for their standard one. And I actually have a copy of that fall risk assessment tool that I'll pass around, because that's the one that I will talk about later in my proposal for a research project. In research study 3, 2 different fall policies were compared at 2 different sites. There was Site 1 that uses the fall risk assessment tool, and Site 2 who uses the fall risk management tool. There were a total of 65 patients in this study, and during this study, 87 falls involving 36 patients occurred at Site 1, with 19 patients having repeat falls. Site 2 had 52 falls with 29 patients and 12 patients having repeat falls. The average age of the patient who fell at Site 1 was 74.7 years, and then at Site 2 it was 77.3 years. And the most common areas for a fall were the bedroom, the dining room, the courtyard, the bathroom, and the lounge. Most falls happened when people were going to bed or coming out of the dining area from 1800 to 1900 and 21 to 2400. And that was at Site 1. In Site 2, the time frame was 9 to 3 p.m. Injuries, there were 43 falls at Site 1 that had injuries and 22 at Site 2. Disorientation and confusion were the most documented cause of falls. So the findings from this study were that this study revealed that 65 patients who suffered falls received 157 different medications, being divided into 45 categories. It says the most common medication given was a vitamin supplement in 70 cases, followed by laxative in 60 cases. So they suggested that a fall risk program be in place. For research study 4, it was completed in 2011, and it also states that most common cause of death in older adults was a fall. And it also says falls are a very important issue in older adults with severe mental illness. With our older adults who have severe mental illness, they also have medical and surgical and other health conditions that can just make that worse.